Vitamin B12 deficiency after 60. 8 warning signs you are ignoring. Right now, I want to tell you about something that happened in my clinic last year that genuinely shook me. A patient of mine, 67 years old, retired teacher, someone I had been seeing for 5 years, came in convinced she was developing dementia. Her memory had been declining for about 8 months. She was forgetting words mid-sentence. She was confused about dates and appointments she would never have missed before. Her daughter had come with her to the appointment because she was concerned enough to want another set of ears in the room. And sitting across from them both, I could see the fear in their faces. That particular fear that comes when someone you love is slipping away mentally and you do not know why or how to stop it. I ran a comprehensive blood panel, and when the results came back, the answer was not dementia. It was not a brain tumor. It was not early Alzheimer's. It was a vitamin B12 level of 82 picograms per milliliter, severely deficient. We started treatment immediately. 8 weeks later, she came back for her follow-up, and the woman who walked through my door was recognizably herself again. The word-finding difficulty was dramatically improved. The confusion was largely resolved. Her daughter was in tears, and my patient looked at me and said, "I thought I was losing my mind. I want to make sure no one else goes through what I went through not knowing what was happening," which is exactly why I am making this video today. My name is Dr. Dylan. I am a physician with over a decade of clinical experience. And today, I am going to walk you through the 8 warning signs of vitamin B12 deficiency that adults over 60 are most commonly experiencing and most commonly ignoring. The signs that are so easy to attribute to aging that most people never connect them to a vitamin that a simple blood test and an inexpensive supplement can address. Please stay with me until the end because sign number 6 is the one most people have never heard of and the one I consider most alarming. Before I get into the 8 signs, I want to make sure you understand why vitamin B12 deficiency is so extraordinarily common after 60, because the reasons are specific, they are biological, and understanding them explains why even people who eat plenty of meat and dairy can become severely deficient. Vitamin B12 is found exclusively in animal products, meat, fish, poultry, eggs, and dairy. It is not present in plant foods, which is why vegans and vegetarians are at high risk. But here is the critical thing that most people do not know. Absorbing B12 from food requires a protein called intrinsic factor, produced by specialized cells in the stomach lining called parietal cells. Intrinsic factor binds to B12 in the stomach and escorts it to the small intestine where it can be absorbed into the bloodstream. After 62 things happen that dramatically reduce B12 absorption. First, the parietal cells of the stomach produce less intrinsic factor with age. Less intrinsic factor means less B12 absorption, regardless of how much B12 is in your diet. Second, many older adults develop atrophic gastritis, a chronic inflammation of the stomach lining that further reduces both acid production and intrinsic factor secretion. Reduced stomach acid means B12 cannot be properly released from food proteins in the first place. Additionally, proton pump inhibitors, the acid-reducing medications taken by millions of Americans for acid reflux, further suppress stomach acid and B12 absorption. And metformin, one of the most widely prescribed diabetes medications, directly reduces B12 absorption through a separate mechanism. The result is that between 15 and 20% of adults over 60 have measurably low B12 levels, and many more are in the low normal range that produces symptoms without triggering a laboratory flag. Now let us talk about what those symptoms look like. Warning sign number 1 is fatigue and weakness, but not ordinary tiredness. Vitamin B12 is essential for the production of red blood cells. Red blood cells carry oxygen to every tissue in the body. When B12 is deficient, red blood cell production becomes impaired. The cells that are produced are abnormally large and poorly functional, a condition called megaloblastic anemia. The result is a profound oxygen deprivation-driven exhaustion that is not relieved by sleep or rest. People describe it as feeling heavy, weak, and completely drained even after doing almost nothing. Every activity requires disproportionate effort. This fatigue is often the very first symptom to appear, present for months or years before other signs develop, and it is almost universally attributed to aging rather than investigated as a potential nutrient deficiency. If you have been experiencing fatigue that feels qualitatively different from normal tiredness, fatigue that is worsening rather than stable, that has appeared or intensified over the past year or two, please ask your doctor for a B12 level. Warning sign number 2 is tingling, numbness, or strange sensations in the hands and feet. This is one of the most specific and diagnostically important signs of B12 deficiency, and it results from nerve damage, specifically demyelination of the peripheral nerves. Vitamin B12 is essential for the production of myelin, the protective fatty sheath that surrounds nerve fibers and enables rapid, accurate signal transmission. Without adequate B12, myelin breaks down progressively. The peripheral nerves, the longest ones in the body, running from the spinal cord to the fingers and toes, are typically affected first. The sensations produced by this demyelination include tingling, pins and needles, burning, electric shock feelings, and numbness in the extremities. These sensations are often worse at night and may be mistaken for peripheral neuropathy from diabetes or poor circulation. The critical difference is that B12-related neuropathy is potentially reversible if caught and treated early, but it can become permanent if deficiency persists for years. Any new or progressive tingling or numbness in the hands or feet in a person over 60 should prompt B12 testing before being attributed to other causes. Warning sign number 3 is cognitive changes, memory problems, difficulty concentrating, mental fog, and confusion. This is the sign that brought my patient to my office, convinced she had dementia. B12 is essential for neurological function at every level. It is required for myelin production in the brain as well as the peripheral nerves. It is needed for the synthesis of neurotransmitters including serotonin and dopamine, and it is involved in the metabolism of homocysteine, an amino acid that at elevated levels is directly toxic to brain tissue and strongly associated with cognitive decline and dementia risk. B12 deficient individuals have elevated homocysteine, because B12 is one of the key nutrients required to convert homocysteine to safe metabolites. An elevated homocysteine directly damages the blood vessel walls in the brain, disrupts neurotransmitter function, and accelerates the neurological damage that manifests as memory loss, confusion, and cognitive decline. The cognitive changes of B12 deficiency are sometimes called pseudo-dementia because they can so closely mimic early dementia that even experienced clinicians miss the diagnosis. The reversibility of these cognitive changes with B12 treatment, particularly when caught relatively early, is one of the most important reasons to test for B12 deficiency in any older adult presenting with cognitive complaints before assuming a neurodegenerative diagnosis. Warning sign number 4 is depression, irritability, and mood changes. The neurotransmitter connection that I mentioned in the context of cognitive changes is equally relevant to mood. B12 is required for the synthesis of serotonin and dopamine, the primary mood-regulating neurotransmitters. Deficient individuals have reduced capacity to produce these neurotransmitters, and the result is a distinctive mood profile that includes low mood, irritability, emotional reactivity, and a flatness or loss of enjoyment that can meet the clinical criteria for major depression. Studies have consistently shown that B12 deficient individuals have higher rates of depression than age-matched controls with normal B12 levels, and that B12 supplementation improves depressive symptoms in deficient individuals, sometimes dramatically and sometimes without any antidepressant medication being required. If you have been experiencing depression that began or significantly worsened in recent years, and you have not had your B12 level checked, please ask for that test before accepting a permanent depression diagnosis without investigating treatable causes. Warning sign number 5 is a swollen, inflamed, or unusually smooth tongue, and this is one of the most visually distinctive signs of B12 deficiency that most people have never connected to a vitamin. The condition is called glossitis, and it manifests as a tongue that is smooth and shiny rather than having its normal, rough-textured appearance, often red and tender, sometimes with a burning sensation, particularly when eating hot, spicy, or acidic foods. The tongue changes occur because B12 deficiency impairs the rapid cell turnover that normally maintains the tongue's mucosal surface. The papillae that give the tongue its rough texture are lost, producing the characteristic smooth, shiny appearance. If you look in the mirror and your tongue looks unusually smooth and red, rather than having its normal textured surface, and particularly if it feels tender or burns with certain foods, this is a meaningful B12 deficiency sign that warrants immediate testing. Warning sign number 6 is one that I mentioned at the start as the most alarming and the least known, and that is balance problems and difficulty walking. Advanced B12 deficiency causes a condition called subacute combined degeneration of the spinal cord, demyelination not just of peripheral nerves, but of the long nerve tracts in the spinal cord itself, specifically the dorsal columns that carry proprioceptive information and the corticospinal tracts that carry motor signals to the legs. The result is a progressive deterioration in balance, coordination, and gait that can advance to the point of genuine disability if not diagnosed and treated. People notice difficulty walking in a straight line, a tendency to lose balance when closing their eyes, a sensation of walking on unsteady ground, and legs that feel unreliable and difficult to control. This neurological picture is often attributed to other causes: Parkinson's disease, vestibular disorders, cerebellar atrophy, when the actual cause is a vitamin deficiency that is completely treatable. In my experience, this is the sign that most urgently requires early diagnosis because the spinal cord damage of advanced B12 deficiency, unlike the peripheral neuropathy and cognitive changes, can be less completely reversible once it has progressed significantly. Warning sign number 7 is pale or slightly yellow skin. The megaloblastic anemia of B12 deficiency produces pale skin from the reduction in functional red blood cells, the same pallor seen in any anemia. But B12 deficiency specifically can also produce a slight yellowish or jaundiced tinge to the skin. Not the deep yellow of liver disease, but a subtle lemon yellow pallor that reflects the breakdown of abnormal red blood cells releasing bilirubin into the bloodstream. If people have been commenting that you look pale, or if you notice a subtle yellowish tinge to your skin or the whites of your eyes that was not present before, add B12 testing to your medical to-do list. Warning sign number 8 is rapid heart rate or palpitations, and this occurs through the same anemia mechanism. When red blood cell counts drop from megaloblastic anemia, the heart compensates for the reduced oxygen carrying capacity of the blood by beating faster, attempting to circulate the reduced supply of functional red blood cells more rapidly. The result is a persistent resting tachycardia and exercise intolerance, shortness of breath with minimal exertion, palpitations with light activity, and a racing heart that seems disproportionate to the physical demands being placed on it. These cardiovascular symptoms are often investigated extensively: EKGs, echocardiograms, Holter monitors, without anyone checking a B12 level. If you have been experiencing unexplained palpitations or rapid heart rate and a full cardiac workup has not identified a cause, please ask specifically for a comprehensive B12 and folate panel. So here is what I want you to do after watching this video. Write down every symptom from the 8 I described that you recognize in yourself: fatigue, tingling, or numbness, cognitive changes, mood changes, tongue changes, balance problems, pale or yellowish skin, rapid heart rate. Then make an appointment with your doctor this week and bring that list. Ask specifically for a serum B12 test and a methylmalonic acid test. The methylmalonic acid test is more sensitive than serum B12 alone and can detect functional deficiency even when serum B12 appears borderline normal. If your B12 is below 300 picograms per milliliter, even if it is within the laboratory normal range, discuss supplementation with your doctor. The treatment is straightforward. Oral B12 supplements in doses of 1,000 to 2,000 micrograms daily bypass the intrinsic factor absorption problem because at high doses, a small fraction of B12 is absorbed through passive diffusion without needing intrinsic factor. Sublingual B12, dissolved under the tongue, improves this passive absorption further. In severe cases or cases where oral supplementation is not sufficient, B12 injections are available and produce rapid correction. I am Dr. Dylan. Please share this video with every person you love who is over 60. The test is simple, the treatment is inexpensive, and the results, as my patient demonstrated, can be genuinely life-changing. Hit the like button, subscribe to Healthy After 60, and I will see you in the next video. Take care of yourself, get your B12 checked. Before I truly close today, I want to give you some important guidance on B12 supplements. Because as with magnesium, the form matters significantly, and most people are not getting this right. There are several forms of B12 available as supplements. Cyanocobalamin is the most common and cheapest form. It is synthetic and must be converted by the body into the active forms of B12. It is effective for most people at adequate doses. Methylcobalamin is one of the two naturally active forms of B12. It does not require conversion and is directly usable by the body. Research suggests methylcobalamin may be particularly beneficial for neurological symptoms, including the peripheral neuropathy and cognitive changes associated with B12 deficiency. Adenosylcobalamin is the other active form and is particularly important for mitochondrial energy production. A combination of methylcobalamin and adenosylcobalamin in a single supplement provides both active forms and is the formulation I most commonly recommend for older adults with neurological symptoms. For people without significant neurological symptoms, cyanocobalamin at 1,000 to 2,000 micrograms daily is appropriate and cost-effective. For people with tingling, numbness, balance issues, or cognitive symptoms, methylcobalamin or the combination form is preferable. Sublingual tablets, dissolved under the tongue, improve absorption compared to swallowed tablets and are particularly beneficial for people with atrophic gastritis or intrinsic factor deficiency. Take B12 in the morning rather than at night. It has mild energizing effects that can interfere with sleep if taken before bed. And one reassuring piece of information about B12 supplementation, it has one of the best safety profiles of any vitamin. B12 is water-soluble and excess is excreted in the urine. Toxicity from B12 supplementation has essentially never been documented at any dose in clinical literature. You cannot meaningfully overdose on B12 from oral supplements. So if you discover you are deficient, supplement generously and consistently without concern about taking too much. Your nervous system, your brain, and your red blood cells will use what they need and excrete the rest. I am Dr. Dylan. Get the test, take the supplement, and share this video with someone who needs it. I will see you in the next video.